What I'd like to speak to is in the Health Committee, the Commissioner of the Health Department came, and basically his testimony was that the CDC is bad and using, quote, pseudoscience, and that we should empower the Department of Health to make these very important health decisions, which will impact every child in New Jersey. And I asked the commissioner why we should entrust them with this magnitude of a health issue after this same department thought it was wise, thought it was good decision-making to put COVID-infected people in nursing homes instead of President Trump's mercy ships and field hospitals. And that resulted in 8,000 New Jerseyans dying. 8,000. Think about that. We went on a 20-year war for 3,000 people. 8,000 people died. And I don't trust them to make any kind of decision for me or for my family, and quite frankly, for anybody, because they haven't earned that trust. He couldn't explain why we should trust them now after such a horrendous decision was made by these folks. Additionally, what he did speak about a little bit, he didn't tell us how he was going to make these decisions. He didn't tell us how he was going to come up, other than to state that he was going to look at different medical associations and determine from there what to do. I just want to remind everybody that some of those medical associations that he referred to in his testimony have stated that men can get pregnant. Want to talk about pseudoscience? That's pseudoscience. Now, that being said, I for the life of me, I don't know why we're doing this. I don't know what we want to do this for. There's two more things that I have a problem with transferring this decision-making to the Department of Health. It's been my experience just from observation that many department heads, when their time is up, they end up going and working for the very people that they regulated while they were here. How will anyone in New Jersey trust that the decision makers on the vaccine schedule won't end up at some pharmaceutical, won't have made the decision to get a good job with a pharmaceutical after they're done their time here as a commissioner or a senior level decision maker? I have no trust. And then finally, during the committee hearing, there was testimony about whether vaccines that were on the New Jersey vaccine schedule but not on the CDC vaccine schedule would be covered under the Vaccine Injury Fund. Now, that's a fund that if you have an injury from receiving a vaccine, it compensates you, especially for the medical care that comes with it. And we did a lookup of it, and reading from the website of the government agency that provides this vaccine injury fund, it states very clearly that that they only covers the vaccines that are on the CDC schedule. So you are going to allow the commissioner to put vaccines on a schedule that children will have to take, and if they have a vaccine injury, there will be no financial recourse for that family. That's a big risk to ask people to take. This bill was poorly thought out, it was reactionary, it was political, and quite honestly, everyone should vote no. Everyone should vote no on this bill. because it's not about science, it's about political science. Vote no.